Hello, I'm Dr. Edward Silverman. I'm an orthopedic surgeon here at HCA Florida Mercy Hospital.
I'm Dr. Michael Mishura, and I am an orthopedic surgeon here at HCA Florida Mercy Hospital.
I'm Dr. Gilbert Bopertui Rojas. I'm an orthopedic surgeon here at HCA Florida Mercy Hospital.
Thank you for trusting us with your care and for choosing Mercy Hospital for your joint replacement surgery. We understand that you have many options and we truly appreciate your choice.
I want to reassure you that our administration, along with your doctors, nurses, physical therapists, and the entire orthopedic team have come together to create an exceptional program tailored just for you.
When I'm in surgery or any member of our team is fulfilling their role, know that you will be treated like family. Your well-being is our top priority, and during your hospital stay at Mercy, you can expect compassionate, high-quality care.
Hello, I'm Dunia Prieto, the Program Director for the Orthopedic Service Line. Our mission is simple: to provide our community with the highest quality of care before, during, and after your total joint replacement surgery. We aim to relieve your pain, restore your independence, and help you return to your daily activities.
Hello, I'm Karen Suarez, the Orthopedic Navigator for the Orthopedic Service Line. My role is to teach you and guide you through the whole process. After your surgery, you will be taken to your assigned room where your nurse will warmly greet you and explain your care plan. Our priority is to get you out of bed on the same day, whether it is your nurse or physical therapy assisting you. We will ensure you feel supported every step of the way. Pain management is a normal part of recovery. We will work closely with you to manage your pain effectively, allowing you to rest and participate in physical therapy. Please communicate openly about your pain levels. Our nurses will frequently check in to ensure your comfort throughout your stay. Your safety is paramount. We kindly ask that you don't attempt to get up on your own. Always call for assistance. We will demonstrate how to use the Call Light system effectively. You will receive a yellow wristband and non-slip socks to indicate that you are on full precaution. Preventing blood clots is crucial after joint replacement surgery. During your stay, we will apply a sequential compression device to increase blood flow in your legs, and your surgeon will prescribe anticoagulant either through medication or injections. Hand washing is the best way to prevent infection, both in the hospital and at home. We also advise keeping pets away from your surgical site until it is fully healed.
Hello, my name is Jose Martinez, Case Manager for the Orthopedic Service Line. Our goal is for you to be discharged home safely. Our case management team will assist in arranging any necessary equipment for your recovery. If your home environment isn't conducive to a prompt recovery, our social worker will discuss alternate options with you. We'll review your discharge instructions thoroughly, and all medications will be delivered to your room.
My name is Juan Carlos Acosta, physical therapist for the Orthopedic Services Line. The occupational physical therapists are vital parts of the rehabilitation team. The occupational therapist will guide you on safe ways to perform daily activities, while a physical therapist will help you regain strength, balance, and mobility. After your surgery, you'll get up and start moving with the assistance from your nurse or physical therapist, utilizing equipment like the walker. By walking and exercising daily, you'll improve your strength and mobility, making it easier to perform your daily activities. Our ultimate goal is for you to have an outstanding experience at our hospital and to be ready to go home the following day.
We will continue to follow your progress throughout your post-operative journey.
Thank you for choosing Mercy Hospital.
With our dedicated orthopedic team, you are truly in great hands.